The pride of Edinburgh, Illinois.
I don't know about that, but I really appreciate you guys having me out tonight. Thank you guys very much.
Tell us about some of the common shoulder problems that you deal with.
Absolutely. So I am an orthopedic surgeon by training. I was lucky I got to train here in Springfield, Illinois, through the Southern Illinois Orthopedic Residency. And then I spent some time in a little Ivy League program last year on the East Coast called Brown. And there they give you some really good upper extremity training. The nice thing about being in a place like that is you get to see shoulders from all walks of life. And the athletic shoulder is a really interesting thing because it's commonly injured. The first thing to know about a human shoulder is it's kind of a masterpiece of biology. And of course, I might be a little biased in saying that because it's what I spend my time with. But of any joint in the human body, in the animal kingdom, it has the largest range of motion, meaning you can get the most movement out of a human shoulder as far as range when you compare that to any joint of any body part in the animal kingdom. So to do that, our body really can't rely on hard, stable things because hard, stable things like bone would prevent motion. So instead, our body tends to rely on muscular portions of our body. So you hear people who injure their labrum or their rotator cuff, or they tear a muscle like their pec or biceps. And one of the reasons that the shoulder can be kind of susceptible to those injuries is because for sake of stability, we really rely on our muscles to move that shoulder and keep it in its socket.
Just like that. Did you see that throw?
I did see that throw.
Can you evaluate that?
It's outstanding.
Okay, there you go. There you go.
Okay.
Full range.
I've got a bad shoulder. Okay, I think I have a partial tear of a rotator cuff. When do you go see a doctor for a shoulder? When are you to the point where my shoulder hurts? I can't reach something in the cabinet up here because my shoulder. What's the biggest red light or the biggest thing that we see that triggers somebody to go to a doctor to see about a shoulder?
So I think those are two really good questions packed into one. The first thing I think is when you're frustrated with your shoulder, when you're at a point with your shoulder where you want more information, come see one of us. It's not a decision to have surgery to come into one of our offices. It's a decision to get more information. The first point of any visit about your shoulder is for you to learn more, because really, until we teach you to understand what your shoulder is and what your shoulder isn't, to let you know what's wrong and what's right, then we really haven't made you an owner of your problem. And how can you decide what you want to do with your shoulder until you understand what's wrong? And so I think the first thing that can scare people is the name on the door, because we're an orthopedic surgery department. And so that makes you think what we do is surgery. You come in, we offer surgery. And that's really not the case. The first thing we do is diagnostic. We want to find out what's wrong. And after we give you some ownership about what's wrong, we can present you with options. All patients have three options. That can really decide what they want to do. The cheapest option, it's better for you, it's better for me, nobody has to work very hard, is just to ignore this thing. Just leave it alone. Let this thing ride.
That's what I do.
Right? It doesn't cost any money.
Sometimes it goes away.
Right? It might go away for a while. And then there are a lot of in-between things like injections and therapy that can get people quite a long ways. Actually, a good cross-section of our patients, and in some problems, a majority of our patients never see an operating room and then make a full recovery because we can get them back in the right strengthening program. Have you guys ever seen a really good high school athlete who's a one-sport athlete? Let's say he's a baseball player, and you don't know that he's really one-handed. So you guys remember Matty Mock, Mizzou football quarterback, recent? So I used to play basketball with Matty at the Mizzou Rec Center where I went to med school. And you'd never know this because he's a quarterback. He has no left hand. If you can guard his right hand, he is inefficient on a basketball court. Well, it's because he doesn't have good basketball coordination. And so your shoulder sometimes can have bad coordination. So physical therapy to re-coordinate the muscles in your shoulder can sometimes get you from a shoulder that really doesn't feel good in its own space, so like Matty playing basketball, and to get it to something that it's more comfortable with, like Matty playing football. And so those physical therapists really act as coordination and strengthening coaches to get your shoulder back doing the things that it does. With regard to your shoulder, as we age, so as we get every year older, the odds that we have some rotator cuff tear go up. And so as we look at a population, as people get older, it becomes more and more likely that they may have a rotator cuff tear. And what to do about that depends on the person and the goals. High demand shoulders, people who are having pain, people who don't do well with therapy, we have options to fix them and options that work really well. But the first step is establishing that relationship and establishing it early, because sometimes a rotator cuff can become so badly torn that we can't fix it. And that's a tougher animal to tame.
Is weightlifting bad for shoulders?
That's a great question. That's a fun question because weightlifting encompasses a bunch of different disciplines, right? We have power lifters, and we know that power lifters develop posterior labral tears. The labrum is kind of a gasket around the socket of your shoulder to help contain your shoulder in the joint. And if you imagine laying down and pushing up on something, there's a lot of stress pushing down on your shoulder. And that stress can sometimes convert into a tear of the back of that gasket, the posterior labrum. So it's pretty intuitive. The other thing you're doing is putting a bunch of undue force on your cartilage. So people who are benching, 2 times their body weight, which is not me, but people who are capable of doing it and doing it regularly, they can give their cartilage a little bit of undue wear, and they actually have a tendency to develop arthritis at an earlier age. However, moderate weightlifting and vigorous activity with the shoulder, as long as it's within somebody's kind of coordinated comfort zone, hasn't really been proven to cause shoulder damage in research.
I've just lifted shoulders today, as a matter of fact. And I don't do a lot.
Mm-hmm.
Low weight, like it's 15 pounds.
Mm-hmm.
Just coming up, down laterally, and then in front, and just getting a lot of movement there. But about 2 weeks ago, when doing that, I got a little bit of a pain in there. And so when I did it, it hurt, so I stopped doing it. So I think what I'm hearing you say is that the first thought you have is when you have you feel like you got an injury, get off of it. Don't continue to stress it.
I think everybody has a different threshold for pain. And so I think somebody like you, who's an athlete for a long time, who's been around athletes, your definition and threshold for pain, probably yeah. Other people need to push through a little bit of pain to make sure they're still continuing to strengthen and train a shoulder. And so it's difficult to say, but that's the nice thing about developing a really good relationship with whoever your surgeon is going to be, because we can kind of work with you to see what your goals are and see what your pain threshold are, and then a physical therapist can keep you safe. And so anybody who runs into pain, and pain that's consistent, you don't back down, take a little time to rest and get better. Somebody with persistent pain, that therapist acts as a really good coach to help you both do coordinated motions and safe motions. I think therapists are a huge resource and something that have really fundamentally changed the way that we care for people.
Yep. Swimming. How good an exercise is swimming for the shoulder?
Swimming is not only a good exercise for a shoulder, it's a good exercise for a person. And so it's a great cardiac workout, right? It's an absolutely zero impact event. So people who have hip arthritis, knee arthritis, hip pain, knee pain from any cause, or lumbar problems, when they go swim, they feel really good. Swimmers are actually some of our more difficult patients to treat because people who love to swim don't want to stop to rest their shoulder because it's what they love to do. It is a high rotator cuff demand surgery, sport. And there's also quite a bit of demand on some of the larger muscles around your shoulder, but it's really healthy for a shoulder because it's not an impact event.
Shoulder surgery, I know people that have had shoulder surgery, and I hear some of the horror stories. You have to sleep in the recliner, and you have to do all these kind of things. Fact or fiction?
So just like anything in science, as we march forward, as we get better with our technique, better with our technology, and we get more research, we mitigate those problems. So if you can imagine, shoulder surgery is not obviously becoming more and more invasive. The techniques are becoming less and less invasive. So there was a time when every rotator cuff repair didn't move at all, stayed in a sling for 6 weeks. And that's all we did. We just said, okay, we're going to wait 6 weeks to let this thing heal before we ever start moving. If you guys injure anything, if you guys have twisted your knee, if you guys have any real ankle injury, one of the important early things is motion. And so as we've moved towards a more early motion protocol, we've been able to take away a good deal of that pain. One of the things that we find is that people who go back to motion earlier, so there's great research to say at 2 weeks, at 6 weeks, and at 3 months, if we fix the rotator cuff at all three of us here at the table, the person who started motion the earliest would have the least pain by far at all of those time points. And so I think that there is some fact there, especially if you're with people who are doing it once in a while or people who aren't treating a large volume of rotator cuffs. But if you're working with a surgeon who's wanting to get you moving early, I think that's a really great thing. It chases away the pain.
You were a high school athlete. You were a quarterback. at Kincaid High School.
Oh my gosh.
Kincaid South Fork High School.
That's
I
right.
gotta
South
make sure
Fork
I
Ponies. Go Ponies.
I get that in there. You talked about playing basketball with Matty Mock down at Missouri. How much does your athletic background help in your diagnostic work as a doctor and your ability to get people back out there? I mean, when I was a kid, when I'm a kid growing up, you sprained your ankle. It's prop it up and stay in bed. You didn't want to use it. It wasn't. Now it's more of a mindset of we want to get people out there as fast as we can. We want to get them healed and back on the field as fast as we can. As a former athlete, how does that help you?
I think the best title for me would be former mediocre athlete. I played baseball and basketball at Edinburgh, and then played a little football at Kincaid South Fork, and loved it. I am a huge high school sports fan. I've already got the Taylorville Tornadoes and the South Fork high school football schedules on my phone. I'm excited about it. I'm going to go watch a couple of Pana games. Pana plays Nokomis in October. I think it's going to be a really good game. So I kind of think it's a romantic time of year. I think the fall and the winter in Central Illinois is a romantic time of year. Grab a bag of popcorn, buy a ticket, and watch them go. With that said, if you bring your kid to me, or your athlete or your child, that kid has a 3-part goal. They want to play now, they want to play later, and they want to have a meaningful rest of their life. And I think you have to address those goals in reverse order. The first thing I have to do is protect the meaningful rest of your life. I'm never gonna do anything or act in any way that's gonna cause long-term damage to that child, that human, that athlete, because they have long-term goals. And I can tell you, getting out on the field for an extra quarter of any game may have been the most important part of my life at 16, but now it's really nice that I don't limp. And I would probably trade a quarter then for no limp now. And so I never want to put a kid back in the game too soon. Their long-term goal of playing again, I think, is the most attainable one. And the short-term goal is all about knowing the right sideline assessment. So Springfield Clinic actually partners with a lot of the schools. We have athletic trainers and orthopedic surgeons both on the sidelines and in the stands for most high school football games in the area, and a good deal of other sporting events as well. And I think the early assessment piece, knowing when kids can safely go back out, is just a matter of having the right person on the sideline. I think it's a really awesome way to partner with the schools too. But I think as long as we keep those 3 goals in mind, we can never steer a kid wrong.
How much say does the kid, the athlete? As a coach, I've been in the training room when a kid gets injured. His dad's in there, the team doctor's in there. It's obviously blown up his knee or he's messed up his ankle. In this particular situation I'm talking about, it was an ankle. We were going into a semifinal game down in Wiley, Texas, and the player was a senior. He wasn't going to play college ball, and he was saying, I want to play next week. I got to play next week. Dad's saying he's going to play next week. The team doctor, have you ever been in that situation when you're dealing with that 17-year-old kid who, this is the most important thing in my life, and I don't care what happens when I'm 50. I want to win this game next week.
I think that's awesome. I think the other thing we have to arm the kids with is our longitudinal foresight, right? That's really important to them, and in 6 months something else may be really important to them. I think our patients, when they are young athletes, and they obviously can act in a way that is good and aligns well with their short-term goals. What I have to do is align well with those 3 goals I told you. And if I think that it's going to compromise either of those other 2, a longer-term career, or more importantly, the rest of their life, I can't, in good conscience, allow a child to return. However, if I think a kid may be okay to return to a sport and they do not, they have a lot to say.
Yes.
Because if they tell me I don't feel ready, if they don't feel ready, there's a thing called a fear index. We actually look at this with return to sport and ACL injuries. And if they're at a point where they have a certain level of fear based on a couple of different ways we can assess it, then it's not safe and we won't do it. I'll go ahead and hold that athlete out. So they have more of a no than a yes capacity. And don't get me wrong, we want players to return to sport as early as is safe, but no earlier. And hopefully if that kid's mad at me in a week, in a month, he'll understand. Or she'll understand.
Sure. Did you have a moment that led you in the direction that you've gone career-wise? What led you to being involved in orthopedic surgery and orthopedics?
I'm a trucker's kid from Illinois. We dug holes and ran semis. I probably are people listening whose driveway that I've shoveled rock in, I'm sure. And for them, I'm thankful for using my family business because that's how we fed ourselves, And we were working at a job site with Tom Borowicki, who is a fantastic joint replacement surgeon in Springfield. And I looked over. I was digging in. We were adding on to his home, and I was in an overdig where we pour concrete with a shovel. And I looked over, and Tom Borowick, he took his work shirt off, and he was in there in slacks and an undershirt shoveling next to me. I didn't ask him to come. I didn't ask him to get in there. He was just down there shoveling with me. And I was like, oh, this dude's okay. And I'd worked at his house for a few weeks on a rather large project.
Is his wife Sandy?
It is Sandy. Isn't she fantastic?
I know Sandy from cardiac rehab. Yep.
He's good. She's better.
Oh, yeah. Yep.
I love both of those humans. And he invited me to come to OR when I was 18, and I was instantly hooked. That's what I was going to do the rest of my life. There were no other choices. And I called him 6 years later, and I said, hey, I work for you now. I'm one of your residents. And he was like, really?
Awesome.
I was like, yeah. And now I work with and for him at the Springfield Clinic, and he is truly, truly a fantastic person.
You are a young guy that's taken off in a career back in your hometown. Why did you come back here?
It means more. So I think culturally, one of the things that we don't always celebrate as people of Central Illinois is we have a beautiful, beautiful culture. We are a really cool people. I've been on the East Coast. I've worked on the Indian reservations in an Indian Health Service capacity, both in the Southeast and in South Dakota. And I've got to experience a lot of regional culture in the United States. There's no place else I'd rather be than taking care of the people that I know and care about. It's fantastic. And when somebody wants to tell me the reason that they really, really just absolutely cannot go to an SHG game, or they cannot miss an SHG game, I understand both sides of that because I'm local. You know, local rivalries are wonderful. I'm going to get to cover local rivalry football games, and it just means more. I'm from here. I see people who I know their whole family. When I get to take care of somebody and put them back to their family in that capacity, get them better, get them back to doing the things that they love, it's really fun for me. It's also really fun for me to get to run across people that I've known my entire life who go, I thought you put rock in driveways.
Good training.
Yeah.
I hope you don't run into any of those 5 guys that intercepted you when you were a quarterback at Kincaid.
I told you a story off the record. I hold the record for the most single-game interceptions ever thrown by Kincaid. My accuracy I would rate as poor to very poor. But we were a running team. I wonder why.
Rourke was
Sounds familiar.
Rourke was a quarterback for a running team, too. Dr. David Tapscott, thank you very much for visiting with us. Very eye-opening. Do you know where you're going to be a week from tomorrow? Football season starts. Are you going to be on the sideline somewhere?
So, full disclosure, my wife is 37 weeks right now.
Okay.
So I will be at a Taylorville football game if I can make it, and if not, I'll be in a delivery room saying, "You're doing great, sweetheart." So one of the two. One of the two.
Good luck.
Encourage her to do that maybe on Tuesday or Wednesday.
We've been talking about it. She's just, I don't know how well she'll listen.
All right. Dr. Tapscott, thank you very much for visiting with us. We're going to be back on the press box after these messages.
Thank you.